we've been moving more and more towards a consumer-driven model, or people call it in general consumerism. And if you really kind of break this down, it's really people taking more control over their own individual healthcare. And certainly we have a lot of things that contribute to that. Certainly Dr. Google is part and parcel of that, and continues to play all of the different sources for information. But again, it's about people taking more control over their individual healthcare. I oftentimes want to think about what's going on with healthcare. I like to kind of draw a parallel to another industry to make it kind of more understandable. If you think about what Priceline is for the travel and hospitality industry, a lot of those kind of metaphors are being driven into healthcare. Think about it. You go to Priceline, you look for a hotel room, for example, and you see, how well is this rated, and now you're bidding on services. And believe it or not, that metaphor actually exists in radiology, where within certain regions you can actually, bid on an MRI or different types of services to try to drive the cost down. Part of the other thing with consumerism is scoreboards. In understanding who's good at what. And again, this is a very sensitive subject, certainly for providers, but I think you'll see more and more what I call scoreboarding taking place within the industry. We see that through star ratings and other types of, more and more engagement, if you will. But again, gaining consumer engagement via these different methodologies, I think, is important to note, but I think the one that's kind of having the most profound impact is technology. And again, part of the whole idea of consumer engagement is really kind of moving consumers to action, and really looking for the kind of results that are, that we expect. And again, it goes back to you inspect what you expect. But part of this, again, driving better access, improved individual health, and obviously driving the cost down are all key aspects of this new consumerism model. The other one to talk about just briefly here, this is probably an hour topic by itself, is consolidation. So, again, consolidation is increasing because, again, I believe it's because the demand for integration, and the more and more demand that we have for integration, the more consolidation we'll see. It's going to be, if you think about the new model and in the value-based payment model, all of the characteristics of a provider organization that are important, it's going to be tough for the smaller providers to exist in that model. Doesn't mean that they won't. I'm just saying is that it will be more challenging, and that will have much more risk involved in it. But again, I think this is certainly true from a consolidation standpoint with providers, but let's not forget about the payers as well. And again, if you think about some of the things that we've seen with managed care organizations in consolidating, you saw Aetna and Coventry coming together, and now you see CVS, buying Aetna. We saw Anthem and Amerigroup come together. You see, Cigna and HealthSpring coming together. You saw Centene and HealthNet come together. We saw Centene and WellCare come together as well now. So you see, again, this continuation of the idea that consolidation is happening both on the provider side, but also on the payer side. And again, a lot of these are happening as a result of gaining efficiency, but also around how do you innovate much more rapidly than we have been in the past. And I think, again, it's important to note that that's happening in both the for-profit providers and payers, but also in the not-for-profit providers and payers. So from that standpoint, you see consolidation happening with community mental health centers. Centerstone has kind of been a national leader in terms of their affiliation model. But again, part of this is how do you develop a model to keep the assets in the community while still offering the strength of being able to combine resources and gain efficiencies as well. So realize that is a trend I don't think you'll see stop anytime soon. And it's one that I think most smart provider organizations that are at least considering in the types of strategies that they're developing in the coming years. Kim, I think I'll turn it back over to you.
Thanks, Paul. So we're going to talk a little bit about how therapy is evolving. So it's important to remember that not just our billing systems and our financial models are evolving, but actually how we deliver therapy and how we deliver treatment is certainly evolving. We've all seen that health plans are playing such a much bigger role in deciding who, what, when, who we can see, the number of sessions, credentialing, if you're in or out of network. We're also seeing that our consumers and our clients both have more limited choices And in some cases, they actually have more choices. If you're a Medicaid recipient, you may have more choices than you used to have. We're seeing more and more of our behavioral health being utilized within integrated care and primary care settings. And of course, tech-enabled is much more the norm than it used to be. And we're seeing a hybrid of all of our systems coming together. Substance abuse, mental health, and primary care are all starting to integrate. So the process of therapy is evolving to a great extent, including our data and electronic health records and how they're influencing your therapy, either for better or worse, depending on where you stand on that equation. But with our documentation standards that are sometimes more rigorous and are changing, the frequency, the forcing to do risk assessments, which is actually a good thing for our clients. And our data systems are also are allowing us to look at productivity and how our different providers are doing. Sometimes our tech solutions also help us with our workforce shortage. If you're in behavioral health at all, there's an immense workforce shortage, especially in our rural communities and for our underserved populations. So some of our tech solutions can certainly help us to reach both our remote areas and then also for our hard to reach clients. So many times I hear providers that they don't want to use technology. They say, we're not going to use technology. We don't believe in technology. But in truth, you probably already are using some technology. As you can see from this slide, if you're using an electronic health record, if you're tracking your referral databases, all the way down to if you're using some clinical decision support technology. So technology has infiltrated the behavioral health field, whether you're realizing it or not. And more of us are switching over and seeing the advantage of what technology can do for us. It's important to remember as we're going through these changes and we're adopting these technology changes and therapy delivery, that we're not just looking at our systems and our policies and procedures, but we're also looking at the change management within our organizations, change management for our staff and for our clients, teaching our staff and our clients how to use this new technology, why they should use it, what's in it for them. And remembering that it's not enough just to implement a new billing strategy, but how are you moving your staff and your clients all into the new space as well. It's also sometimes difficult for our staff and for our management too, as we start tracking productivity. I used to run a behavioral health clinic, and the first time I looked at the productivity of my psychiatrist, it was eye-opening to me. But through a change and through all of us working together, we were able to increase our productivity. So I think it can be a good thing, eye-opening along the way, but don't forget to help your staff and your teams, as well as your clients, manage through this change process. So as we're looking for this and how technology can create this new competitive forces, all different kinds of things, we're seeing so many more mental health apps, trackers, systems that our clients and our consumers can use. It's convenient, it's personalized, you can take it with you. As we have a more traveling or more diverse clientele, clients who go all over the world, go all over the country, that move around, through some of these tech-enabled systems, they can keep the same therapist no matter where they are in the United States or really around the world. We can see some of these, how this changes our options for our consumers. It also sometimes allows people that have different credentialing to be able to offer services. We might call them paraprofessionals, or folks with lived experience can also participate in providing services, and oftentimes technology will help them. So if you're waiting for thinking that, well, therapy is going to change or therapy is going to evolve, therapy has already changed and evolved. I think at this point, we have to make sure that we've got our systems and our staff and our clients ready for it. And looking at all three of those components, our structure and systems, our staff readiness, and our client readiness is going to be a key to really successful moving into these new avenues of therapy service delivery.
All right, very good. All right, so we're going to talk just for a few minutes about critical management and kind of the operational competencies that are necessary to kind of operate in this new world of healthcare, with both the technology changes, but also how we innovate as an industry. How do we actually deliver on this idea of quality and value? So this is some key performance domains for the industry at large, for health and human services, and specifically for provider organizations. So if you look across here, on the left side, you have high performing on payer contracts, all the way moving right to financial sustainability. And it's important to note, if you think about in today's world, more and more things are being driven by NCQA's HEDIS measures, and HEDIS, which I'm sure a vast majority, if not all of the participants in this webinar understand HEDIS, which is Healthcare Effectiveness Data and Information Set, which basically is more than 90 measures across 6 domains of care. The NCQA collects this HEDIS data from health plans and other healthcare organizations. And again, these performance of each of the measurements can be incorporated into pay per performance or value-based contracts. And important to note that of the 90 measures, 8 specifically relate to behavioral health. And if you haven't really kind of engaged in these, it's important that you begin understanding what they are. Adherence to antipsychotic medications and antidepressant medication management. Again, the most important one I believe that I see probably more focused on is follow-up after hospitalization for mental illness. So after a psychiatric hospitalization, part of the HEDIS requirements are, did you follow up within 7 days, and did you follow up again within 30 days? And what are the reasons for that? We know, based upon kind of solid data and solid evidence, that we see that follow-up happening within 7 and then again within 30 days, the chance of readmission and recidivism into the system is very, very substantially less. So from that standpoint, all of these measurements, whether they're HEDIS, the STAR measures, even the ones that are being developed and implemented by health plans, all of those are really kind of driven around what we know, what we can square up with practice today, and we know will derive a benefit. And these are where I think some of the largest yields I see in terms of where payers have partnered with provider organizations to kind of create the accountability around these. Because again, let's find things that we can agree upon, and these are certainly solid things I think that people are expecting. I think, just again, looking at across this slide, the other one that I want to point out is your online reputation for your organization matters, and it's mattering more and more. There's more organizations, websites, and others that are measuring and, providing input in terms of, your competencies, et cetera. Sometimes this can be very unfair. Other times it can be, very helpful in terms of driving traffic to your organization. But the reality is that your online reputation does matter. And again, I kind of draw the line back to Priceline for Healthcare, and that you have to realize is that you are becoming more of a retail supplier of services, and that reputation does matter, and it needs to be managed more holistically. Certainly, social media can have a huge impact on an organization, right, wrong, or indifferent. And again, I'm not saying that these are solid measurements by any stretch, but I'm just saying that they are competencies that your organization have to develop, and develop strategies on how you're going to deal with it. The other one I think that's probably I see more common is the Net Promoter Score. And again, I think the message here is that customer service does matter. And again, I would argue that it can be a competitive advantage. So if you think about customer service across all domains, all industries, healthcare probably falls somewhere around the airline industry in terms of customer satisfaction. Not really all that great. And again, I think this is one where a healthcare organization can create substantial competitive advantage, even for not only just the patients or the opportunity to serve your healthcare community, but also for staff. As Kim pointed out a few minutes ago, that's an area where a lot of organizations have a lot of challenges, is recruiting staff. And again, I would argue that this online reputation combined, with customer service and Net Promoter Scores, create the infrastructure to start having that backbone of saying, this is something that's important, that our organization can differentiate itself from others. And I think
I agree. And Paul, if I can interrupt, especially with your customer satisfaction, many times the Medicaid population or the underfunded or unfunded population didn't have a lot of choice. Or providers knew you have a contract, you're going to serve this population. But with changing reimbursement systems, consumers do have more of a choice. So more and more providers who serve the Medicaid or the underfunded, unfunded population really need to start thinking about their customer satisfaction, because consumers do have more and more choice in some venues.
Absolutely. I mean, I would even argue safety net providers are in the same boat as all of the rest of them. And again, a lot of lot of environments it would say that safety net providers are necessary, et cetera, which they absolutely are. But again, if you start adding aspects of customer service onto, you know, even the required organizations, it becomes even more critical in terms of what's expected from the new healthcare era, if you will. I think the other one is really to talk about new and innovative clinical programs. And a lot of organizations I talk to, when I start to talk about their ability to innovate, a lot of them just say, you know, we really don't have the money to innovate. We really don't have the capability to be able to make those kind of investments. And a lot of organizations have really created some very creative partnerships within specialty providers, within communities, with payers and others. But again, these partnerships really are where a lot of the innovation's happening. If you think about what accountable care organizations, you know, their main charter is really around that idea of combining kind of best practice or best of breed providers to create an organization or partnership that actually, you know, gives that holistic view of healthcare. I think those are really, really important for organizations, and not to just, you know, kind of rest on, you know, we don't have the money to do this, so therefore we're not going to do it. But it's to try to figure out new and creative ways of doing that. And again, you cannot ignore technology in terms of your ability to innovate. The lastly thing I'll point out from this slide, you know, again, around the financial sustainability, and I think a lot of provider organizations kind of can identify with this, is that, you know, in traditionally with behavioral health providers, there have been lots of balance sheet challenges. So, you know, again, strengthening of your balance sheet is really, really important. And again, being able to scale your organization and be able to weather some storms in terms of, you know, as the healthcare economy shifts, to be able to do that in a kind of an effective way by, you know, obviously raising revenue, having a very close handle on your profitability and understanding where your cost structure is at a much more granular level, I think is incredibly important. And to be able to use whatever leverage, you know, with debt to equity or others, you know, again, become critical components of kind of this new era, if you will.
And Paul, if I can also add one more thing for financial sustainability, for nonprofits particularly. I know I've been involved and worked with nonprofits who see fundraising as part of their cost strategy, which is great, but you have to remember to look at your true cost for providing that services with or without your fundraising dollars. And people sometimes get that mixed up, that your true cost is what it actually costs you to provide service, not what you're getting paid to do it. There's a difference between what it costs you and what you're getting paid to provide that service, and you have to take into account how much of that you're actually doing through fundraising if you're a nonprofit.
Very, very, very true. And you know, a lot of organizations are even jettisoning programs that they're upside down in. Just simply from a sustainability standpoint, you can't continue to run programs that your financial picture is bleak at best.